Well, happy, beautiful, amazing day. Dr. Bob Rakowski here with this edition of the Dr. Bob Rakowski podcast. I have Dr. Peter Hong, and we were just chatting. His health journey, his contribution journey is now over 50 years long. He likes to say he's been in practice more than 40 years. My math makes it look like it's about 45 plus, but he's got a phenomenal system-based approach to health, to chiropractic, to posture, to life. So, Dr. Peter, first and foremost, welcome. And might want to go with your backstory. So, you entered Northwestern Chiropractic College or Northwestern in 1975, right? So,
Yes.
now tell me about that. What prompted you to go to chiropractic college?
Yeah. Good morning, Bob. It's my pleasure to be here, and I actually I have a idea to be helping people, and my cousin, which is an orthopedic surgeon, introduced me to chiropractic, and actually it's a really different way of people, expecting from a orthopedic surgeon, and here afterward, I become a chiropractor.
Certainly, orthopedic surgeons can be great allies. If we have someone that breaks something, we send them to a surgeon. If someone needs surgery, we send them to a surgeon. But wouldn't it be nice if they sent more and more people back to us? So, you talked about your journey, and you were only claiming 40 years of practice because you spent, was it 5 years writing 2 different books?
Actually, the two different books is actually it's just one book. This that's two volumes. Because I have to cut down uh, the size so that one fits in as a reference only. So the other part is the nitty gritty of the ideas.
Alright, so you have a systems approach, so let's define that. What is your approach, and how is it different from what other people are doing?
Uh, The systems chiropractic is based on systems thinking. Basically, when we are talking about things, we will say, "Oh, this is reductionism, and this is holism." So people will be, in a way, thinking different things at different time in terms of that two philosophy. And even the same type of practice, we're doing certain things will be this and that. Yeah, but those are very fixed kind of thinking. Uh, but in systems chiropractic, basically we're seeing things in a very flexible way because it's very natural for us to be thinking in a big way and then in a small way and try to understand in details. But we go back to the original, what we are doing, what we are trying to achieve, So it's moving from a holistic into the reductionistic kind of thinking. So the reason why it's like that is systems chiropractic or system, based on system thinking is thinking uh, in a big term, but we are seeing things in that is interconnected, and they are working in that way so that it will, based on the feedback mechanism, it will bring out a lot of emergence kind of phenomena. And most of the time, we are so confused with the problem is because we are seeing the emerging uh, problems, not the cause of things. So that's what systems chiropractic comes in and try to solve the problem that way.
Well, my first degree is electrical engineering, so I love systems thinking. One of my favorite TED Talks is entitled "Everything's Connected, Here's How." It's by a physicist from MIT. It's not just our body that's connected, the systems in our body, but we're all connected to each other. We're all connected to the earth. We're all connected to the universe. So we can take that to the highest level. But in looking at your post, you like to look at posture, biomechanics, neurology, and even lifestyle. So let's talk about those 4. Why posture? And what do you do? Do you have just people stand up? Do you have their eyes closed? Do they march in place? How are you gonna assess their posture?
First of all, we are seeing a person not in a rigid kind of things. We are not seeing it. Oh, we are checking the posture itself, because posture is just a manifestation of something, a certain aspect of our whole makeup. So the thing is that we are studying the postural system, and the manifestation we can get out from that is the different kind of uh, uh, presentation in the posture. But looking at a person with a head inclined one way, or their body a certain way, or moving certain in a certain way very rigidly, does not means that they have a problem there. But something inside is trying to balance. The balancing mechanism cause this phenomenon. So we are not rigidly looking at, oh, you have a high shoulder, a low shoulder kind of thing, but rather we are trying to understand, what's causing it, and step by step, using the biomechanical way, we are isolated certain things, and then we use the neuroscience kind of thinking into why these things happen, and we test it, and then try to see what the result is, and that's how it goes.
I like how you describe posture. Posture is a whole system. Most of it is subconscious. And when things go wrong on the inside of the body, it will show up in the posture, and people need to know that, but it's somewhat through the neurology. So you also talk about neurology. So what are you assessing there in addition to posture?
The um, the main thing is that when we are talking about the system, we have the input and output, and we call the system itself, we are humbly call it a black box or a gray box. So the thing is that we are trying to test the system and see, and maybe I go to the output first. The output is our muscle tone. Okay, so the muscle tone imbalanced is we can see it, in different ways. For example, people with meningitis, they will extend it all the way back, and then for other people, maybe vestibular system kind of thing, they may be tipped one way than the other, because of the tension on both sides of the body is different. So for us, this is the key to help the person, is to find out which side the muscle tone is stronger than the other. Actually, it's a little bit most of the time, but it's significant enough to find the problem. So, for example, because I put a lot of work at one time in upper cervical, so people may attempt to feel the occiput and C1 movement by feeling, by X-raying the person and orthogonally analyze it. But those are not the direct um, thing that actually happens into the body at that moment. Okay, so for example, by closing one eye, we know that the the head will balance, so the eyes are seeing things stiff. The level again. So there's a mechanism involved to achieve that. So based on this mechanism, we can have the patient uh, close one eye, and then check the muscle tension, and then close the other eye, and then check the muscle tension. And then if there's a difference in a certain way, and it will change accordingly, we can say that it is a good chance that there is something happening.
How are you assessing the muscle tension? Is it just palpation or how the patient feels, or you have some type of tester for that?
Yes. Basically, the best way is to have the person standing, and then we can have them turn the head to one side, and then mark it how far the chin is from the shoulder, and then we do it on the other side. So that kind of difference, actually, when you try it, is sometimes very significant. It's
Yeah.
not just wow, a little bit. It's never. It's a big deal. So with that, we can easily a- uh, able to tell what happened.
Okay. So we're going to look for posture. We're going to recognize that the eyes have impact, the entire spine, the neck, everything else. You also talk about lifestyle. So, what are your favorite lifestyle tips? And I wonder if it's different in Hong Kong than it is here in the US.
Actually, this this is the East meets the West kind of thing, eh? And it's yin yang is the complementary half of the whole. I share with you a little bit. It's about because in Hong Kong, a lot of us are living in a really high stress situation, and the first time I found a problem years ago when I turned on the what's it, the Jupiter, the Symphony, the Jupiter, and then the patient actually relax. There's one type that the emotion is so strong when they comes into my office, then I check them. Oh, everything is so tight, and then I cannot even able to find uh, something on the body related to that. And then when I turn on the music, the Jupiter, actually things happen. Things become wow, all relaxed. There's no difference in the muscle tone anymore. And
Now,
then the next time, remember,
is that universal for that song, or does it have to be a song that someone really likes, or what type of music would relax the whole body?
actually, I search. Actually, this is I think a research. There's a old folks home. People are round up into different sections, and they use that Jupiter as a music for to calm down the people on one side, and the other side actually they have another music. But it's not a very scientific way of doing things but it's a research anyway. So they found that the balance of the people that listen to Jupiter actually is more relaxed. And Jupiter, a lot of times people use it in a lot of ways, like the mothers, try to calm down themselves and try someone that is bearing children, they try to let the children feel the beats, of the music. And I dare not to change it to another music because it seems to be so good. So I tell the patient, go back home. YouTube have that, so you just turn it on, listen to it, and then the main thing is that have them understand that there is there's a lot of things in life they have to work towards, and basically the mental part they have to concentrate on to be to be able to achieve their health goals.
I'm thinking about, like, systems of healing, like Ayurvedic medicine. Deepak Chopra is a author here in the US, and they're they love sound and sound therapy and sound healing, and there's even different sound studios, where people have, like, gongs and different things that play different musical tones. So, I'm not familiar with Jupiter. Now, is that a song, or could
Oh,
someone play a
oh, sorry.
particular tone, or
Actually, it's the Mozart symphony. Is the 41.
Mozart's 41?
Yeah,
Okay. Well,
well, we
Mozart.
call it the Jupiter. Sometimes I because I'm not a person that is inclined to listen to classical music, so I just remember the name.
They've done different types of, experiments where they'll play different types of music and in plants, and they found classical music helps plants to grow beautifully, and then some of the music that's out there today, which is pretty harsh and has a bad message, The plants don't like that. So, yeah, that's pretty fascinating. So, you're also an educator. So, when did you decide that you wanted to really impact the whole world and especially the profession of chiropractic? And how's that coming along?
The first actually is a gradual kind of development. At first, I'm thinking of just helping pick my patient, and the first patient is myself because I suffer from a car accident, and afterward I've been seeing different chiropractors for a period of time without any progress. Finally, I find upper cervical chiropractor and able to help me. But the thing is that I don't believe that this is uh, the uh, the best method. It's never, because every method have its uh, have its goodness of it, and we don't know what we are able to do with this method, but um because we heard a lot of good things, but when we try out, the patient will be the person that just like a guinea pig. So this for that reason, I try to first understand what upper cervical is doing, because the method that I use don't even put a force into the body. It's the sweat method, and it's so beautiful. And it's just a sound that is able to transmit through the bone, not not on the atlas, but on the muscle into the in your body. And the thing is that I found that out because I put the SEMG pad on the neck and try to understand. And I found that actually is like a vestibular uh, uh, yeah, vestibular evoked muscle potential. So this kind of things really work, not because of a force that makes the bone move, but rather because of the contraction of the muscle on one side relative to the other, and actually it makes a little bit adjustment, which is enough when you are positioned a body at the head in a certain way. So from that point on, I determined to proceed accordingly and try to find different. How can I find the proper level to help the person rather than guess the upper circle must do the work. This will do the work. I mean that is too subjective and putting the patient in a disadvantage when we are trying to experience that. So from that point on, I work towards it, and finally, my goal is to help people to do that. Once I set my goal to help people, then actually things come to me very fast. And then I find that, oh, now it makes sense if I do this way and I do this way. So things become very smooth afterward. And and so I just have to proceed in that direction.
You said a lot of things that are really, really valuable, and I want to just dive into that a little bit. So first and foremost, you start talking about upper cervical, the very top of the neck. There's chiropractors that specialize in that. So we're gonna have all kinds of people watching this. I just wanted them to know that. And there's some people they line up the upper neck, and so much gets better in the body. Now, interesting enough, you said you did get benefit after your accident. But you also realize that one, they don't contact the bones ever. The bones are under muscle and ligaments and tissue. So if you position the head appropriately, if you apply, and the people that do upper cervical, they don't use much force. They're very, very light.
Yes.
And there's forceful techniques. Hey, don't ever hurt anybody if you're using force, and very low force techniques, which I tend to really, really like. So when you're teaching other doctors, what's your starting point? Do you start with the upper neck? Do you start with posture? What do you think is the best way to get people more aware of how everything works together?
The the first thing is our thinking.
Ah,
The thinking is the most important part. That's why at first I try to explain it in as a manual kind, you know, but afterward I found out actually putting it the science and the technique itself does not make sense because people don't understand why you have to do this, and they fall back to the old way uh, of thinking. So the thinking itself is the most important. So, but thinking have to be influenced rather than by teaching them, you should do this or that. I mean, it's not right anyway. So people have to experiment, and we have to have them in a certain kind of uh, understand actually why the purpose of this profession and what the healing profession is doing and what we are trying to achieve for the patient, for the humankind. I mean, there's a lot of things as a background to understand why we have to go from the holistic way into different very important aspect deep inside and then come back again. And so uh, this is that's why the book is important. Is that they have to read the book and then try to understand, in that way, rather than forcing ideas into their mind. And then once they have developed, and then things go, very fast. So very easy, and then you can read it and you can experiment by what I have written down as the so-called techniques, and then and then maybe hopefully they will be at one or two courses, and then things will be, you know, it's really easy. And then the good thing about this method is that once that part is clear, it never comes back. You will never adjust things the same spot every time. And I hate to be a upper cervical chiropractor, only work on here or, every time a patient comes in. And actually, is not supposed to be because there's a lot of things we have to clear. And once it's clear, it's not exist anymore.
I love that. I'm going to take a quick sponsor break. This podcast is brought to you by bettercoffeeshop.com, the best organic coffee in the world, 2 years running, reishi infused, everything counts. As we like to say, friends don't let friends drink moldy coffee. 94% of the coffee in the world has some type of toxins in it: herbicides, insecticides, fungicides, molds, mycotoxins, heavy metals. Bettercoffeeshop.com, the cleanest coffee and turbocharged with reishi mushroom. So I like what you said about having to do it once, clearing it and moving it on, because I see people that have been to a lot of different doctors, a lot of different chiropractors, and a lot of them try to tell the patient, okay, this is your pattern. And every time, this is what we need to do. But reality is, we should be changing that pattern. So now you'll see a difference in the pattern. How long is it before the patient starts to see a difference in the pattern? Is it within the visit? Does it take a week, a month, a year, or is it case by case?
Uh, the as a upper cervical chiropractor at one time, I when you work on here and the person have acute low back pain, how can you convince them? You have it's related. Actually, it's uh very easy for us because we check at that time, muscle leg, the leg length and also muscle tension. So we have to tell them what we are checking at first and what we are trying to achieve, and educate them right in the first visit, you know, and then we demonstrate to them what I want to change. For example, the chiropractor that treat me uh, and that help me with my problem he just tell me at that time after he examined my posture and other things, and he just tell me, Peter, will you raise up the left leg and then raise up the right leg? That's what he told me. And amazingly, what I I I feel I cannot raise the leg up when I'm lying down. Ow. When after his correction, he asked me the same. And then, wow, my legs just fries up. So, and this is very important for us as a healer to explain to the person what we are helping you. We are not treating your pain because we don't know how long the pain will be there. And you may have other problems that contribute towards the pain. But the thing is that we have to have an assessment that they can bring it home, and then knowing that they have been corrected. And it's so important for them to be supported in that way. And then make sure that you explain to them, you know, the importance of what we are doing with that. And then next time they come back and then and they say, wow, I open my eyes and I close my eyes, and then, no, it's good. Can you feel that? It's free, They they understand. They When you are telling them, in an honest and scientific way, they understand. There's no reason why not. So I think the communication is the most important.
Yeah, well, I like that, right? People don't care how much you know till they know how much you care. That's for sure. That's the starting point of everything. And if we make better decisions, then we create a better life. Peter, we're winding down. This time is just flying. So, do you have a story do you want to share or a piece of advice as to how people can really take charge of their life at a systematic point of view and make it better?
Um, people in what sense? A chiropractor?
Sure, or just life in general, right? Everything's connected. It's a systemic universe.
Oh,
So, what do you have a common piece of advice that you give to people that seems to help them maybe more than anything else?
I think the world actually is wrong, and what we are treating each other, you know, really comes back to how we are being treated. So as a chiropractor, I think, you know, it's okay to be a patient at one time. And then you understand, you know, um, how they are suffering and what you need to be care. So we can develop our skill in that direction.
I think empathy is a big part of it. I'm thinking early my first year in clinical practice, I herniated a disc in my back, and I thought, well, that had to be the reason. I just need to figure out what my patients were going through, and I'll tell you what, it was a valuable experience because I found out, 1, how good chiropractic is, and 2, how much patients really, really suffer. So, Dr. Peter, what's the best way for people to reach you?
The best way is to get on my site. There's a uh, my site is drhong.com.hk, and you can find some details of the book, and also you can have the contact information. You can fill the contact form, and then you can find me, and that I definitely will reply to you.
Beautiful. And are you able to treat patients across the world? Are you able to treat people virtually, or do they need to see you in Hong Kong?
Oh, actually, when I'm practicing as upper cervical chiropractor, I draw patients, from far and wide. It's not only in Hong Kong because, not too many people practice upper cervical in that way in this area. So, but now I'm retired, and then I contribute myself to the profession in another way.
Well, that's awesome. I'm going to wrap this up with the words that I typically use. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful So, Dr. Peter, I know it's 3 o'clock in the morning for you. Thank you for going the extra mile to share your wisdom and certainly committing your life to making our wonderful world better.
Thank you very much, Dr. Bob.
You are very welcome. Thank you back.
Thank you.